Okay, hello.
Hello,
What is your name?
Kyung.
And how old are you?
I am 55 years old,
Where do you live?
artist Kayatwa.
And what is your occupation?
Currently an office worker.
Okay, what was your previous job?
I was factory worker,
And what's your nationality?
Malaysian.
And what is your marital status? Is it single, married, or anything?
I am married.
Do you have any children?
Yes, I have one daughter.
Okay, noted. So, what are your complaints?
So for a few years now, I have had this feeling of heaviness and itching on my right calf, along with large bulging vein.
And when did you start to see these bulging veins?
The vein appeared about 15 years ago back when I was still working in factory. It was less prominent, but after a few years, when I switched to my job as an office worker, the vein became larger.
Okay, do you feel pain on your leg?
I don't feel pain when I massage my leg, only this itching feeling. I also feel tingling and cramps, especially at night.
Does it radiate anywhere?
No, it's only on my right calf.
When does the aching usually happen?
Usually when I am standing or sitting for too long, around 10 minutes it will appear.
And what will worsen the aching?
If I don't move, it worsens.
And what do you do to relieve the aching?
I either massage or try to elevate my leg and walk around a little.
How frequent do you experience this aching sensation?
During office hours when I am sitting on my desk for a long time and at night.
Are there any other symptoms you are experiencing besides aching and cramps?
My right leg often swell. The skin on my calf, where you go see the bulging vein, has a brownish red color. I especially feel very weak on my right leg.
Since when did your leg start to swell?
2-3 days ago.
Have you taken your temperature?
Yes, it's 36.5.
Do you have changes in your appetite?
No.
Why did you decide to visit the hospital now and not before this?
The first few years when I saw the bulging vein, there were barely any cramp. Even if there were cramp, it was still mild and bearable. Nowadays, ever since I started my office job, where I had to sit for a long time, the itching and cramp become worse, especially at night.
When did you start your office job?
5 years ago.
From the scale of 1 to 10, how would you describe the pain of your cramps or aching during these past few days? 1 being the least pain, to 10 being the most severe cramps.
Around 6.
How were your aching and cramps compared to previous years before you start your office job on a scale of 1 to 10?
Before this, I would say it was around 3.
Okay, I'm going to collect your past health history now. So please answer my question. Do you have gastric ulcers?
No.
Do you have allergies to any food, medications, or anything?
No.
Have you had blood transfusion?
No.
Do you drink alcohol or take any sort of drugs?
No.
Does any of your family members has any past illnesses?
Both my parents have varicose vein.
Okay, have you ever had deep vein thrombosis?
No.
Have you ever fractured any bones?
No.
Have you had any past operations?
No.
Do you have diabetes mellitus?
No.
Do you have tuberculosis?
No.
Stroke?
No.
Myocardial infarction?
No.
Hypertension?
No.
Hyperlipidemia?
No.
Do you take any medications at the moment?
No.
And have you ever had any past infections?
No.
What kind of vaccine have you taken?
COVID.
Okay, that's all. Thank you. So, patient social data. His name is Kyung, age 55, is a male, lives in Actors Kayadua. He's an office worker, previously worked as a factory worker. He's a Malaysian. He's married, has one daughter at 20 years old, and he was admitted on 17th October 2023. He had complaints of aching, cramps, and large varicose vein located on the lower right extremity on the calf area. There's no radiation, only on the calf area, and the character is heavy, throbbing ache. The intensity during the previous years, it was around 3 and recently increased to 6. The time of appearance is around 15 years ago, and the duration of the aching cramps is usually during standing and sitting for too long, for around 10 minutes, and it increases when there is lack of movement. It decreases when he alleviates the leg and after a leg massage, and also during walking. The frequency of this aching and cramps is often during the evening and night. Additional complaints he had was tingling, edema of leg, hyperpigmentation of the right calf, muscle fatigue of the right leg. As for history of the present disease, presence of varicose veins appeared 15 years ago when his job was a factory worker. The size of vein increases over the years and worsened after changing to his new job. So feeling of heaviness and night cramps appeared together with varicose veins and worsened after changing to his new job. A patient recently had edema about 5 days ago in the right calf. Patient has no fever, appetite is not affected. Patient did not take any medications, did massages to temporarily relieve aching. He decides to visit the doctor when the aching and night cramps become more frequent and severe during the past few days. As for past health history, he had no there's nothing differences except his family health history. Both mother and father has varicose vein. And as for my conclusion, patient has no elevated temperature, so there's no signs of infection or sepsis. The disease is progressing. Patient is suspected to have second-degree chronic venous insufficiency and most likely primary varicose vein. The predisposing factors are highly likely due to hereditary factors, prolonged physical activity on the legs associated with professional activity. There are also possibilities of deep vein thrombosis due to similar clinical pictures, and so more emphasis should be done for examination of the peripheral vascular system.